So the biggest issue faced in Indigenous communities, and particularly out this way, the biggest killer of Aboriginal people is heart disease, closely followed by suicide due to depression, grief, alcohol and drug issues. And it's just not observed from me. It's been identified by communities, especially the elders, who it impacts the most because they're having to look after their children's children. You know, guys, we like to pretend we're tough and don't want to see doctors. We don't want to take medications for something we should be able to deal with. We don't talk to our mates about it because it's seen as being soft. And we really need to shift that idea that we can't seek help.
I've seen the impact that it has on our communities. I've grown up around it. It's there, you know, it's not hidden. And I've seen people unfortunately pass away of it, and it's something that it pulls strings in my own heart, you know, and it makes me passionate, you know, about looking after ourselves as Aboriginal people. Alcohol and other drugs, you know, obviously has a profound effect on an individual, but the effect that it has on the community around them is a flow-on effect, you know, and it can be something that is felt from the youngest people in the community to the very eldest, you know, and it's something that is still very much an issue out here that we're working towards, but also, you know, how do we educate our people, or how do we educate those that we work with? It's an underlying issue, and it's something that's not always addressed as best it could be, and so we talk to people on the street, we talk to people down at the river, you know, we talk to men at men's sheds and things like that, and we build people's trust and we build rapport, and it's through that way then that we actually try and address some of the issues that they may be facing. There are other avenues that you can turn to, that you can do. There are other interests that you can definitely partake in, and you know, the world's a lot bigger than just what we may see around us every day.
I'm really proud that the flying doctors have seen something missing, and that we're now starting to address it. I'm really proud to be part of that. I've grown up knowing the flying doctors and worked with them for a really, really long time, and I have a great respect for them, but they never had Indigenous workers, so it wasn't something I could aspire to. So when someone offered me the job, it was kind of a bit unrealistic for me to comprehend, because no one had done it before. So it was, I feel proud that the flying doctors saw potential in me. It's got potential to be one of the most valuable and self-satisfying roles that I've ever taken on.